Welcome back. This segment is sponsored by iChiro, Peak Performance Chiropractic. They focus on a whole body approach to wellness, not just treating one injury, but your entire body. And joining us now is Dr. Mike Kwast from iChiro, Peak Performance Chiropractic. Good morning. Good to have you here.
Hi, thank you.
Okay, so when somebody goes to see a chiropractor, do they usually come to keep their body healthy or to say, oh, something's killing me?
Well, unfortunately, most people only know about pain relief, and there's a lot of things that can be done to prevent problems that people just aren't aware of. And so it's all about education. We just want to know that we're doing our best to make sure we're teaching people so you as a patient can make the choices that you want and be informed.
And of course, I suspect that by keeping the body tuned up appropriately, that you avoid getting to that point where you're showing up in a state of pain.
Yeah, the cool thing is we have a bunch of tests that you can actually do that show you where your body function is so you can see where you're at.
We are looking at a video that you guys provided for us to show a variety of the things that can be the source of pain and really what an adjustment does to alleviate that.
Sure. A lot of people don't realize the muscles and the tissues along the spine are really the big culprit with so many of the problems that are out there.
And so this is showing what, the result of an adjustment, or?
Yeah, I can show you. We have our patient Mandy here who are going to be able to show you how we would actually check a patient. Typically when somebody comes in, first thing to do is we do an evaluation to find out what's going on, what's wrong, and we've already done that with Mandy. But
yes.
The actual treatment part where we check to find where she needs treatment.
Okay, let's dive in. Show us what you do.
I can show you. Basically what we're going to do is we're going to be looking for motion in her joints of her spine. So I'm going to actually feel for any compression or tension in there.
Yeah.
And what that tension will do is it'll stop the motion. So then she doesn't move right, which makes her more likely to have an injury.
Yeah.
So I can actually feel that by pressing along the spine. I'm looking for tight spots. There's a tight spot right here, so I'm just going to press in there, and that's what we call an adjustment.
Yes.
You may have heard cracking or popping. I don't know if you could hear that, but there's sometimes cracking and popping, which is just a gas release inside the joints.
It's not the bones. I went on and watched some of your videos to learn about what you do, and it's not the bones hitting each other. You're actually releasing some gases.
Yeah, you're actually opening the joint up by stretching the muscles. So we're actually not adjusting even really the bones, but the muscles and tissues around that to stretch them and open that up.
Okay.
And so this checking that we do, if I go back to that same spot and I push here, that is now moving really well. I can't even make that crack and pop anymore because it's already opened up. So the joint is opened, or if there's tight muscle, it will be compressed.
And that release, that actually brings relief as opposed to pain. Because sometimes I used to think that was sort of violent, but really what you're doing is bringing relief.
Sure, and you could see that wasn't really aggressive and crazy.
Yeah.
But what happens is when you do that, there's a reflex that happens that causes the muscles in that area to instantly relax. And that typically will bring relief. The problem is it's muscle, so you have to do it enough that you're going to see like some changes. You're not going to change a muscle, you know, in a magical visit any more than going to the gym one time is suddenly going to make me fit and in shape. So it does take some time to see where that is.
And then you continue working all the way up the neck, right?
Yep. What I would do next is I would have you go ahead and turn on your side towards me. And then again, this is called the check. So I don't even know where her spots are today until we actually feel that. So we're feeling for motion, and you could actually hear that cracking and popping in there. Now if you watch this, I can go back and check it again.
Nothing.
There's nothing, because now that joint is open and moving normally, which is what you want. Go ahead and lay flat on your back. And then we would just check her neck too, and we would see what's happening here, and I would just feel where there's a tight spot right here I can feel, and so we just gently push in there.
That one, yeah.
And same thing.
Yeah, wow.
And as you can see, there's no twisting or turning. People watch too many karate movies and they think that, you know, there's all this violence going on, and you can see that's very gentle and easy and very comfortable. Mandy's pregnant. We see a lot of pregnant women out there because they can't take drugs. Yeah. Which then makes you wonder, should you take them?
Period, if you can't do it when you're pregnant?
Exactly.
Yeah, right.
So we see a lot of women who are looking for natural solutions, want to have a better go when they have their baby, and just have everything working as good as possible.
Well, we want to let you know, iChiro Peak Performance Chiropractic has 2 Grand Rapids locations. One is on the East Beltline, one is on Kalamazoo. Also, you need to be sure to check out their free Trigger Point class on April 15th. It's at 6 p.m. at the East Beltline location. You need to call the number there on your screen. It's 616-447-9888 to reserve your spot. We've also put this information on our website at wzzm13.com under Take 5. Thanks to both of you
for
being here this morning.